it's Coach Tori, and this is Raising Runners. We will be talking about running, mental health, youth sport burnout, specialization in sports, motivation, encouragement, coaching, parenting, sleep, nutrition, really anything that you can think of that we as parents or coaches or just runners can do to help our young athletes. Today's interview is with Dr. Sarah Pospos. She completed her psychiatry residency as a chief resident at UCLA Kern. She is a sports psychiatrist and former athlete, so she is devoted to helping aspiring current and former athletes with depression, performance and general anxiety, insomnia, and other psychiatric challenges associated with injury, concussion, retirement from sports, overtraining, and so many other things that she can help you with. Dr. Pospos also empowers athletes to optimize and balance their lives by incorporating exercise, nutrition, sleep, stress management, efficient time management. She is a mom of 2 under 2, so she knows all about it, and other lifestyle changes. It was such a great interview. You will hear there are a few moments where the audio is either a little bit delayed or there is some breaking up of the audio. We were having a storm here and she's so far away and I don't understand technology enough to know which of those things was causing the problem. So it is worth a listen. I promise anything that was missed or cut out, either the audio catches up a little bit or one of us will summarize what was missed. So I promise it's worth it. I know it's not always fun to listen to the audio when it gets a little glitchy, but hopefully you learned something from the interview. Like sports and psychology and it's kind of like all of the things with our run club anyway, because we really try to, it's all about running, but it's also trying to incorporate like mental health on a really, really baseline level and like making it more of like empowerment type stuff that like everybody can connect to. So I was like, oh, this will be perfect.
Right.
So I guess just to start, you want to just explain like how you got into, because I think you said there's like more things you like talking about than just, you're a sports psychiatrist. Is that right?
Yes.
Okay. So I guess just kind of, how did you get into that? What was your inspiration and kind of what do you do typically when you're not just talking to me about running and my family troubles?
Absolutely. So hi everyone. My name is Sarah Pospos. As Tori mentioned, I'm a sports psychiatrist and a former student athlete. So as you probably know, sports psychiatrist just means that I'm a medical doctor who's specialized in psychiatry, who's super specialized in sports psychiatry as well. So I'm devoted to helping athletes, including their close ones, their loved ones, families and coaches like yourself, with common psychiatric challenges, like, for example, competition anxiety, overtraining syndrome, burnout, depression, and so many other common challenges that often happen to athletes. So I'm based in California. And I have my next available appointment is by telehealth. It opens, the next available one is in September. But for non-California residents, perhaps those in Pennsylvania, I also do offer additional free resources at my website, which is lifestyletelesychiatry.com/subscribe. And in terms of how I got into sports psychiatry, as I mentioned before, I was a former student athlete, so I did experience firsthand some of the unique challenges that you may also be going through, or your athletes may also be going through. And as an athlete myself, I believe that there's a gap that needs to be filled in this area. And what better way to pay it forward rather than combining both things that I love, right? Psychiatry and sports. And that's how I become a sports psychiatrist.
I guess I want to start, what sport did you play and how did you get into that?
Yes, absolutely. So I'm not a runner, first of all. I did competitive swimming back in elementary school, and then I dabbled a bit on volleyball and basketball as well.
Oh, wow.
Afterwards.
Okay. Yeah. So I was going to say swimming can be a lot like running though, with like, it's individual, but you're on a team, but I cannot relate to other team sports because I don't think I could even play them if I tried. Could you, I know I'm like, when people get far away, there's like a tiny little delay and I'm like, it always just gets a little, I'm like, am I going to talk over you or not? But so you're a sports psychiatrist, and I feel like often people hear sports psychologist more often. Can you just explain the slight, if there is a slight difference or a bigger difference? Because I know that you are able to do more with like the medical things and stuff, but if should people come see you versus a psychologist depending on what's going on, or can you kind of just explain the difference between why you would see a certain person?
Yeah, that's a great question. Absolutely. So typically within sports, so sports psychologists, they could help you with things like improving your athletic performances, mostly through mental skills training. So several methods that could improve that within that space. However, sports psychiatrists, similar to any psychiatrist, doctor in general, they help deal with others. For example, like depression, anxiety, insomnia, PTSD, post-traumatic stress disorder, if it applies, and things along those lines that happen to athletes. And I guess to dive in even further, the difference between sports psychiatrists and general psychiatrists in general, I would say there are two things at least. First, typically a sports psychiatrist was an athlete in their past life. So that way they probably know firsthand in terms of the unique challenges, like I mentioned, that athletes went through in the past, or are more aware of the nuts and bolts of what's happening in a certain competition or a certain sports setting. And perhaps more importantly, they are more aware of the nuances when prescribing medications if indicated. And what I mean by that, by those nuances are, athletes, of course, values their athletic performance, right? And some medications, it might affect athletic performance inadvertently, perhaps. It might improve them. And so it's considered prohibited, quote unquote, in certain sports, whether it's at all times or just during competition. And this, as you can imagine, is a very much a concern for athletes or their coaches or even their parents as well, that they may inadvertently take medications that could lead them to being in trouble in those settings because of that reason. Also, some medications might have some side effects that could impair athletic performance. So, for instance, some might cause you to gain weight. Some might cause your heart rate to be lower, which, as you probably can tell, would impact performance in endurance sports like running, and things along those lines. So it would be an ideal scenario, or an ideal fit, I would say, if you need help with mental health in those settings or in those areas, to seek out help from sports psychiatrists for that reason.
I'm so glad you got into that, because I was about to ask you if you often run into those issues of, like the doping problems, but also because I know when I was in high school, and again, it wasn't like that competitive, but I did have to take different medications for migraines that I think fall on some of those other spectrums of, like, not quite psychotropics, but things close to that. And I definitely felt the difference. So how do you, I'm sure, everything's individual and you have to really work with the specific client, but how do you navigate that, or help people navigate that if it's like, I think you really, really need some kind of help, but the help I can give you isn't something you can take while you run, or it's going to impair your running? Like, how do you work through that with athletes, especially if, whatever you're thinking they need is something they're not allowed to have at whatever competitive level they're at?
Yes. So first of all, you're spot on, right? Everything is case by case in terms of just their situations, their preference, their sports, for instance, and things that they value. So with that being said, we do, medication-wise, at least, we do have several options for different conditions. So in those cases, I would mention all of those, including the pros and the cons. So for example, for condition A, our usual first line medication would be this: But in your case, especially, although the benefits include XYZ, the cons that you might be considering include XYZ. As a plan B or as an alternative, we also do have this medication or that medications which work similarly, and their pros and cons are so on and so forth. So in that case, I believe empowering the athlete themselves, or in this case, the parents perhaps, to make an informed decision of the next steps, to exactly know what's going on and what are the possible or the available options in this case, and how they pertains to their athletic performance and their condition, mental health condition in general too, is very important, so that they can make as a team for that.
You cut out a little bit at the end, but I think you were just talking about making the best decision for them ultimately in the end. Is that what you were getting at?
Exactly, to work hand in hand together to make the best decision for the patient.
Okay, perfect. And then I'm imagining you probably don't often see younger individuals, because I would guess that it's usually, more competitive. Is that true? That you're seeing older, yeah, I guess like not older teens, but I guess like what age group, actually, that would be a better question instead of me just assuming. What age group of people do you usually work with?
Yes, definitely. So I do work with adults within my practice. In psychiatry, typically, if it's a younger patient, so 18 or younger, 17 or younger, we also do have a subspecialization called child psychiatrists. And some child psychiatrists also do specialize in sports psychiatrists. So that would probably be a better fit in terms of that age group.
That's why I was like, I feel like I know that they're usually it's split up, but I'm like, why couldn't I figure out how to ask that question in a normal way? But let me get into some of the questions, because I know we kind of have been brainstorming a little bit. And just kind of starting off with like I think an easy place, if you could just, because I think we all know like exercise is good for you, right? And like sometimes that can be the first place to start. If you're not feeling great, like, hey, maybe getting up and walking outside and getting some fresh air, like might be a good place to start. Do you have a simple explanation as to like why exercise is good for us, or like, what's really going on there? If it can be simple, I don't even know.
Yes, yes. I love that questions. Absolutely. So exercise is good for us, actually, for, as you can imagine, a number of reasons. So I would break it down into 3 categories: biologically, psychologically, and just socially, right? So biologically, in terms of the science behind it, for one, exercise affect the brain chemicals in our brain, including the chemicals that helps with our mood, lessen our anxiety, helps with sleep, and things along those lines. The second thing is exercise induce what we call BDNF, or brain-derived neurotrophic factor, which is essentially a miracle grow, if you will, to our brain. So this chemical, they stimulate the growth of new brain cells. But not only that, they also improve the functions of our brain cells and improve the connectivity between these brain cells, so that their function and their connection between one another is even more boosted up, among other physical benefits of exercise that everyone probably already know, including, lowering improving your cardiac function, cardiovascular function, decreasing your risk of chronic conditions like high blood pressure, high blood sugar, things like that, and even decreasing your mortality rates down the line too. In terms of the psychological benefits, as you all probably also experience at some point, exercise increase our sense of self-mastery. And all the athletes and coaches and parents probably are familiar with this, which just means that it boosts our self-confidence and just kind of our sense of mastery in terms of problem solving ourselves, having a good self-esteem and things along those lines, by gradually, right? So day by day, whenever we put in the exercise, it all grows and grows and grows. And then in terms of socially, also providing or swimming, it does offer some chance to interact with others, and that could also, on the flip side, prevent isolation, which is very detrimental to mental health in general, and especially in those with certain mental conditions like depression or anxiety, for example.
And that was a super helpful answer. And it's great that you could put it in all those different categories, because I think sometimes we're just like, we know it's good for you, it makes you healthier, you feel good, but it's like, why? Right.
Right.
So no, that's awesome. So let me see. We also were talking about, where did I even go with that? All the mental health diagnoses and sports. And I didn't even get to finish reading. It was like an 80-page article, and I did not have time today to finish that. But we kind of talked, and obviously, you know better than I do that, we can see sometimes people using fitness or health or sports or all those things as a coping mechanism for some kind of mental health struggles. But also you were saying that we can see a high portion of people with mental health diagnoses in sports. Can you explain, I guess, like why we're seeing that? But then also kind of where that goes, like, is it because we're using it as a coping mechanism? So there's that strange correlation, or, it's something else going on, I guess.
You're cutting off a little bit.
Yeah, I know. I was like, I'm not sure if I was like, it looked like it looked like you were freezing too. And I was like, I think you maybe aren't hearing everything. So, well, that's probably good, because my question was all over the place. But can you hear me now?
Yes, I think so. Knock on wood.
Yeah, if it keeps cutting, I'll switch to my phone and see if that helps instead. But no, so we were talking about the prevalence of people with mental health diagnoses in sports. And you mentioned that you knew, especially with like female track athletes. But I guess, can you explain like some of the reasons why we see that? And then I guess if you want to start with why we're seeing those things and what's really going on there.
Yeah, definitely. So I think there's two-part answers to that question. So the first one would be some specific mental health conditions or specific mental health diagnosis have different trends when we compare it to the general population, so the non-athletes, right? So for instance, for depression, just as an example, the rates, some studies consider it to be similar with the general populations. However, the suicide rates in sports and athletes is lower than the general populations. I believe it's significantly lower as well. On the other hand, some mental conditions in athletes are found to be higher than general populations. And the example for that would be gambling, pathological gambling, or some studies, this is still not confirmed by all studies, but some studies suggest ADHD is also could be higher in athletes versus general populations. And the second part of that questions, I would say in terms of the depression in specifically female track and field athletes, there is one study, NCAA study, so this pertains to college students, not necessarily youth athletes, that says the depression rates among athletes is highest among female track and field athletes, so within this field. There are several possible reasons for that. What they mention, for example, number one, it is an individual sport, and some agrees that individual sports has higher rate of depression versus team sports in general. The second possible explanation is or a high risk of injuries, and just the nature of it, it makes the athlete continually compete to others, but also to compete with themselves. So it's very high pressure in that sense. And then some propose, maybe the personality types of the athletes who drawn to track depression. But the catch of that is this study is done in just one university, so one setting. So it also may be related to specifically, for example, the culture of that department, the logistics infrastructure of the track and field in that particular university, and other specific factors related to that. And just to expand on that a little bit, perhaps we can hone in on why individual sports are thought to have higher depression rates than team sports in general. Possible reasons might include, first, in individual sports, they have high internal attribution after negative events. And what it means is just that after a negative events like losing, an injury, or things along those lines, they just attribute those negative events internally to themselves versus more more objectively see it as, it could just happen by chance, or there could be a lot of external factors that affect that as well. So they kind of take it all in and blame themselves in that sense. The second possible reason is in individual sports, the athletes might just have a high perceived perfectionistic expectation from others. So they might, care more about what other things in terms of their performance. I need to be perfect. I shouldn't disappoint others, whether it's my coach, my parents, just everyone who watches me and things like that. And the other reasons, the third one perhaps, is because in individual sports, there's just by nature a lower social support or social cohesion that happens because of the nature of the sport.
Thank you so much for explaining not only the individual versus team sports, because I don't think we always, especially for me who only does running and only ever did individual sports, like think of those big differences there. But also thank you for explaining the way the studies were done, so that even though those were the findings, like you said, there can be so many other factors as to why they came up with the conclusions that they did. With that, so I kind of was thinking, as you mentioned, people with ADHD, for example, in sports, like that can be high. That also made me think of the people who, and I know I've probably done this in the past too, but are like, oh, running is my therapy. Like I need that to be able to function, which like probably is true, but also like, should that be true? So I guess we talked a little bit, I think, when we were messaging as well, about running or sports as a coping mechanism. And, what is that a good coping mechanism all the time? Because I'm thinking, especially for the people with ADHD, I'm sure there's a lot of reasons, but I imagine it's like, as a child, they're running all over the place. It's like, throw them into sports, get them tired. That could be something, but what do I know? Because I didn't study that. But I guess, like what is going on with that using that as a coping mechanism? Is that something we should be doing in moderation, or, what really happens with that?
Great question. So absolutely, exercise, like you mentioned, is a great coping mechanism, right? Because of all the benefits, physical, mental, and otherwise, that we had already talked about earlier. It's considered in general a healthy coping mechanism versus, let's say, other types, substance use, or anything along those lines, just to give a simplified example. But there is a concept called exercise addiction. It's still proposed in a sense that it's not written yet in our psychiatric textbook, which is the DSM, if anyone is familiar with that. But for this concept of exercise addiction, they proposed that there are 4 phases when exercise as a regular healthy coping mechanism could be considered as an addiction. So the 4 phases, the first one is recreational exercise. In this phase, exercise is just done because it's a pleasurable activity. Rarely, if ever, there are negative consequences for the exercise. Phase number 2 is at-risk exercise. So here, we use exercise because we realize that internally, there's a reward. For example, it helps with our mood. And it may bring some negative consequences, but it's still the direct outcome of the exercise. The phase number 3 out of 4 is problematic exercise. At this phase, we could see, someone's organizing their whole day around exercise. So it becomes very rigid in that sense. And the consequences become secondary negative consequences as well, which means we can see it perhaps in ourselves, but also in others around us, close to us. People are start noticing and not in a good way. And the last phase, 4 out of 4, would be the exercise addiction phase itself. So in this phase, the frequency and intensity of exercise is just amplified to the point that it's, the main organizing life principle of this person. And therefore, the negative effects touch almost every aspect of their day-to-day life. So for example, it starts to affect their work, their grades for the kids or those in school. They start, they cannot fulfill their roles any longer as parents, as a wife, husband, and as a son, daughter, and what have you. So it's just really interfering their functions in that way. That's when it's become, or it's considered a problem, or it's called an exercise addiction.
Now, I imagine, because you touched on, the way it's affecting their lives negatively, but I imagine that also has some significant health impacts too. Would there be specific ones that you would notice? Like I guess not everyone's going to say like, I have an exercise addiction, help me. Like what kinds of things, I guess, would you see besides you're saying like, they're just not functioning, in their daily lives, but like, are there physical things we would see or other kinds of warning signs, I guess?
Yes, definitely. And I don't think I catch the last part of your question. So please, let me know if I don't answer it fully. So yes, in terms of physical symptoms, just like you mentioned, it could, it could be manifested in a lot of different ways. One, perhaps more common ones that come to mind might include body image issues, and physically it could be seen as a significant weight loss, way below someone's recommended BMI, body mass index. And when that starts to happen, it also does typically have a lot of other physical symptoms associated with it. So for instance, their heart rate, when you check it, it becomes slower. They might have problems with their hormone, thyroid and whatnot. If you check their bone, the density might be a little less than ideal and things along those lines. The perhaps the more noticeable physical signs that one could identify themselves. It could interfere with their sleep, which would be the easier one, I guess, to self-identify, right? And the snowball effects of that, of course, if you don't get a good enough sleep during the day, you might experience things like having trouble focusing, feeling tired all the this concept called overtraining syndromes, which just means that despite taking a period of rest to improve your performance just wouldn't increase, or it may even continue to decline.
Awesome. Thank you for that. And I feel like you cut out a tiny bit, but I feel like we didn't lose too much. So I'm hoping that you're not going to look back and be like, well, you missed the entire thing. But yeah, so next time we record, I have to make sure it's not on a day we have a storm, because I'm thinking that maybe why I'm having some connectivity stuff going on. I don't know. It's been thundering and lightning all day, but
oh my goodness.
I'm like, when it rains, it pours, I guess.
Oh, sorry.
But no, that's great for the
right.
overtraining. That's super helpful, because I think we can misconstrue like dedication and hard work, and depending on what level you're trying to be in your sport, like there is going to be things that you're going to have to miss. There's priorities you're going to have to make. What, I guess, like, where do you start with helping someone? And I'm sure this is, again, like we talked about, probably all individual. Am I cutting out? Yeah.
A little
But
bit.
where where do you start with helping someone with, an overtraining syndrome, or, starting to go in that direction?
Yes, great question. So, um, I think the principle perhaps would be utilizing general medicine and in psychiatry. We usually try to get a very detailed data from our interview. So that would mean that we ruled out other medical conditions, other situational factors, or just other possible factors that may cause it before deeming it "quote unquote" overtraining syndrome, right? So some questions to consider might be, when is this underperformance starting? What's the nature of it? Getting a training diary or training or competition data and whatnot. And then they're getting more info on their sleep habit, nutrition, menstrual history, things along those lines. Medically, we want to make sure we cover or we know all about their medical history, because some medical conditions, acute or chronic, might affect, as you can probably tell, performance, psychiatrically as well. So we just wanted to get all the data first, to consider what's going on in terms of their root cause. And then there are the next step would be to conduct some of the basic lab tests, just to make sure we ruled out everything that we need to rule out. So that might look like, you're doing your blood test, checking your iron level, checking your vitamin D level, renal function, things like that. Uh, and then, of course, after that, if we know the diagnosis, in this case, if we really do think it's overtraining syndrome, the management would be multifactorial and interdisciplinary. So it's ideal to meet not only with the athletes, but the coach, family members if they want to, and also other specialists who might include nutritionists, performance nutrition scientists, who might include exercise physiologists, who can advise on the best or most effective way to train logistically, who may include sports psychologists who can give those mental skills, just kind of to improve their performance even further. And everyone ideally needs to be on the same page. And most importantly, the athletes themselves needs to know what they're gonna train in terms of their training plan. What are they gonna do, and why are they gonna do it, and how are they gonna do it? So we get their the athletes buy-in as well. So that way, all the little components hopefully are taken care of, and it could result in a better performance.
No, that is super helpful. And I mean, it's amazing. I feel like everyone I talk to, we're always talking about the whole team of people that you have to bring in to help athletes. So I feel like that kind of perfectly rounds out, the themes I'm always trying to pull in, but also just our conversation for today. But do you have anything else you wanted to add? And I know I'm going to have to make sure I get all the links for your information to, set up telehealth or anything like that to be able to get info from you. But is there anything else you wanted to add really quick before we are done for today?
Yeah, definitely. So I just would like to add, for those who are listening, for the parents and the coaches, um, as you know, running and sports in general prepare or give our athletes a lot of life skills, right? That can be used for sports and beyond. But let's imagine if you could also add one more thing, impart one more gift to them. And that would be the knowledge that mental health is as important as physical health. Imagine how liberating that can be. Imagine if you can equip them with a skill for self-awareness, and that is knowing what's going on with themselves, especially if something's not right, even if it's internally, and you can help them to feel empowered to do something about it. So help them to choose not to suffer alone, but be brave enough to seek help. And imagine, that you could impart the wisdom of having sustainable lifestyles. I know athletes typically already do pay attention to exercise, sleep, nutrition, stress management, and this kind of things. But consistently incorporating this day by day, it's just like investing a few bucks in the bank every day, right? So 20, 30 years down the road, all this compounded interest would definitely be seen in their physical and mental health. So that, I think, would be my parting words to all of us today.
Wow. Yes, I couldn't have said it better myself. That was the perfect way to end it. So thank you again so much for taking the time to talk to us and give us all that really valuable information. I would love to have you back. So hopefully we can set up a time so you can give us even more info on all the mental health wisdom that you have as well. But thank you so much. I really appreciated you talking to us today.
And thank you so much, Tori. May I also add, thank you so much for creating your running club, the Meraki Running Club. I hope I'm pronouncing it right. It's perfect in a sense that I think personally too, it combines running and also empowering the kids with all the mental health skills that they need and just being empowered in general. I think that's fantastic. So thank you.
Thank you so much. Again, I want to thank Sarah so much for her time and also bearing with the weird connectivity problems that we were having. Hoping to have her back so we can get some more in-depth discussions about different mental health topics and fitness and running. Can't wait to have that discussion with her. Also, I will have all of the ways that you can get in touch with her if you need to meet with her virtually or if you just need to talk with her about questions and things like that. I will have how you can reach her that way. Yeah, and thank you for tuning in. I hope you thought it was as great as I did. I really had a great time learning everything that she had to share with us. Thank you for tuning into Raising Runners. New episodes every Tuesday, and we are always looking to talk to people about running, mental health, or anything along the spectrum that can help our young athletes, or just talking to runners or parents and coaches of our young runners as well. Hopefully you find our resources helpful. If you have questions, comments, or anything else, feel free to email me at merakirunclub@gmail.com.